Got deep frown lines? Today's simple routine could finally change that. Deep frown lines are one of the face's most misunderstood signals, something many people are told is just aging or thinning skin. But what if those lines across your forehead weren't cosmetic at all? What if they were your body's quiet signal that tension has been building for years, circulation has slowed, and your nervous system has stayed stuck in stress mode far longer than it should? So in this episode, we'll explore one structured facial routine made up of 8 precise exercises and one deeper internal shift that together will soften forehead tension and reduce your forehead wrinkles. Welcome back to the Senior Health Podcast, where we East meets West to help you stay strong, steady, and independent for life. Today, we're taking a close look at why frown lines and forehead wrinkles become so pronounced after 60. And how ignoring these subtle signs can make the face look tense, tired, or worried far faster than most people realize. Because according to the American Academy of Dermatology, more than 80% of forehead wrinkles are classified as dynamic wrinkles, meaning they are driven primarily by muscle activity, circulation, and nervous system patterns, not damaged skin alone. And sitting across from me is Japan's oldest physician, who reminds us that aging isn't a decline, but a message, and that the face often whispers what the body needs most. Welcome back, Doctor.
Thank you, John. It's always a pleasure to be here. And before we begin, I'd love for everyone listening to share your age and where you're watching from. And ask yourself the question, have you ever noticed your forehead look tense, even on days when you feel calm? Because those lines are often the body's earliest signal that something inside is out of balance.
Yes, at least I have.
For me too, John. And that tightness across the forehead is often one of the first visible signs that internal rhythms are being disrupted. Most people blame it on age or skincare, but often it's something deeper. And when you learn how to support the body correctly, those patterns can soften and change.
Right.
So today, we're starting from the inside, looking at the deeper systems that quietly trigger frown lines and forehead tension. And if you stay with us, you'll learn the exact 8-exercise facial routine that helps restore circulation, calm the muscles, and soften the expression naturally.
Frown lines always remind me of a man I treated in his 70s who came in asking for a cream. But what he really needed was release through his forehead, his breath, and his nervous system. We followed the full process you'll be showing us today, and within weeks, the deep lines softened, and he told me his face finally matched how he felt inside.
It's remarkable, isn't it? When we listen to the face, the whole body begins to respond.
And that's exactly where we're heading next. Before diving into the first exercise, please tell us very briefly what's really happening inside the forehead when these lines start to deepen after 60.
Well, what's happening inside the forehead after 60 is less about skin thinning and more about muscles that stay partially contracted for years. Those muscles stop returning to a full resting length, which quietly slows circulation and reduces oxygen to the tissue above them. At the same time, the nervous system begins to treat that tension as normal, so the forehead holds effort even when a senior feels calm. Over time, that combination leaves lines behind as a record of stress, not age.
That really changes how I hear seniors talk about their faces, because so many feel they're doing something wrong with skincare. It sounds like the body is adapting to tension rather than breaking down.
Yes, and I hear that a lot in seniors who believe creams or treatments should solve the problem on their own. Those approaches work on the surface, but they do not speak the language of muscle or the nervous system beneath it. When massage is random or forceful, the forehead often tightens further because it does not feel safe. This is why sequence matters, because muscles release best when they are guided in the right order, not pushed.
That helps me understand why effort alone can sometimes make things worse.
Of course, once seniors see that tension follows patterns, the solution becomes much clearer. And the first pattern we address is always the quiet center of the forehead.
That feels very intentional, almost like setting the tone before anything else happens. So let's start right there. Doctor, please walk us through the very first exercise you teach to release the center of the forehead safely and calmly.
Of course. Let's begin right at the center because that's where most long-held tension quietly settles. I usually ask seniors to place their index fingers gently just above the bridge of the nose, right between the eyebrows. Then, with slow awareness, they begin a deep but calm kneading into the soft tissue, letting the fingers sink rather than slide. The key here is not force, but listening, because this area has often been holding effort for decades without rest.
That already feels different from how most people think about massage, especially the idea of listening instead of pushing. It sounds like you're asking seniors to slow down and notice, rather than try to fix anything.
Yes, and I hear that a lot in seniors who believe more effort will bring faster change. But this central area is like the anchor of the forehead, and if it does not feel safe, everything around it tightens in response. When they stay here for about 1 minute, breathing softly and keeping the forehead smooth, circulation begins to wake up on its own. Many feel warmth or a subtle easing, which tells us the muscle is remembering how to rest.
That sense of warmth seems like an important signal to pay attention to.
It is, and it tells us the body is ready to move forward. Once the center begins to soften, we can gently expand outward without losing their calm.
That makes me curious about how you guide seniors from that first release into the next area without the tension creeping back in.
Yes, and after the center has softened, we move directly to the temples because they quietly pull the forehead back into tension if they are ignored. Seniors place their thumbs on the temples and sink them gently but deeply into the soft tissue. Then, with the index finger, we make a hook shape and then move in different directions, keeping the pressure steady.
That feels like a very different sensation than most people expect, especially using the thumbs instead of fingertips. I can imagine seniors realizing how much tension they've been holding there without noticing.
Exactly. I usually tell seniors to take 1 full minute for this massage and not rush, because the temples respond best to patience. When the thumbs stay deep and the finger movements remain slow, warmth often spreads across the sides of the entire forehead, which tells us circulation is improving. Once that lateral tension softens, the forehead no longer pulls inward as strongly, and the earlier release can actually hold.
It really sounds like you're protecting the progress from the first step.
Yes, and this prepares the tissue for movement in a new direction. After the temples settle, we guide the forehead upward in a way that feels very clear to the hands.
So once the temples feel softer, what comes next?
Let me explain. Once the temples have softened, we move back to the center and guided the tissue upward, because the forehead needs to remember vertical movement again. Seniors place their fingers at the bridge of the nose and slowly move upward toward the hairline, placing the middle fingers from both hands on top of each other, while keeping steady contact with the muscle underneath. The motion is slow and deliberate, and the focus should be on the muscle and not on the skin.
That upward motion feels very intuitive, almost like lifting weight that's been sitting there for years. I can imagine seniors noticing how different it feels compared to rubbing side to side. I guess we do this also for 1 minute?
Yes, and this step often surprises seniors because they realize how restricted that upward movement has become. I usually suggest repeating this motion several times, always slowly, paying attention to how the tissue responds rather than counting passes. When done correctly, the forehead begins to feel more mobile and alive, and circulation improves without any sense of strain. This step builds on the earlier release and starts restoring natural movement patterns.
It sounds like this is where the forehead starts to feel more open, not just relaxed.
Exactly. Once the tissue can move upward without resistance, it becomes ready for a different kind of contact that teaches it contrast.
Okay, so after restoring that upward movement, what comes next in the sequence?
Yes, and now we introduce contrast because the forehead needs to feel the difference between letting go and being guided. Seniors place all their fingers across the middle of the forehead, right at the center. They begin with a very light, superficial brushing motion, moving horizontally across the forehead, just enough to calm the surface. Then, without changing direction, they press the fingers deeper into the tissue and repeat the same horizontal movement as if gently pulling the muscles apart underneath.
That shift from light to deep sounds subtle, but I can imagine it feeling very different in the hands. It feels less like working harder and more like changing the conversation with the tissue.
Exactly. I hear that a lot in seniors who are surprised by how effective contrast can be. By alternating between superficial brushing and deeper contact, the nervous system begins to recognize release more clearly. I usually encourage repeating this pattern a few times, always slowly, letting the forehead respond rather than rushing ahead. This step restores glide between layers that have been stuck together for years.
It sounds like this is where awareness really deepens, not just sensation.
Yes, and once the tissue can move freely like this, it becomes ready for more precise pressure. The next step focuses on points that often hold tension quietly without being noticed.
I think we have done 4 exercises so far, and they have been feeling amazing. So after creating that contrast across the forehead, what is the 5th exercise of this routine?
Yes, and now we slow everything down even more because this step works with very specific attachment points. Seniors gently form their hands, like this, and place the fingers right along the inner brow area, close to where the muscles attach under the eyebrows. They apply steady pressure and move gradually from the center outward, stopping at each point instead of sliding past it. At every spot, they pause for about 5 to 7 seconds before moving on, allowing the tissue to respond rather than forcing it.
That stopping feels important, almost like giving each point time to answer back. I can imagine seniors noticing tension they didn't even realize was there.
Exactly, because these attachment points quietly hold stress from years of focus and concentration. When they rush through this area, the muscle resists, but when they pause and breathe, the tissue begins to soften. This is where many fixed creases start to ease, because the muscle finally regains a small amount of vertical freedom.
It sounds like patience here matters more than movement.
Yes, and when seniors breathe slowly while holding each point, the forehead often feels less guarded overall. Once this area begins to release, the tissue becomes warm and responsive, which tells us it's ready for deeper integration.
So after working point by point like this, what comes next in the routine?
Yes, and this is where the contact becomes more specific, because now we use the knuckles instead of the fingers. We gently form loose fists and place the knuckles against the forehead, working into the tissue with slow, deliberate pressure. We alternate between a lighter touch and then deeper knuckle contact in the same area, moving gradually across the forehead. I usually recommend staying with this step for about 40 seconds, allowing enough time for the tissue to warm and respond.
That change in contact alone feels significant, because the knuckles must communicate very differently than fingertips. I imagine seniors immediately noticing the difference.
Exactly. I hear that often in seniors who are surprised by how clearly the body responds. With the knuckles, the sensation should feel deep and warming, never sharp or painful. If there is discomfort, It means the pressure is too strong or the movement is too fast, and easing off allows the nervous system to stay open instead of guarding.
So the knuckles are not about force, but about clarity of contact.
Yes, and when seniors learn that distinction, this step becomes very effective. It prepares the tissue for the next area, where tension tends to settle most stubbornly between the eyebrows.
After working with the knuckles like this for those 40 seconds, where do you take everyone next in the sequence?
Yes, and now we come to the area that holds some of the deepest concentration and stress in the face, right between the eyebrows. Seniors gently pinch the eyebrow tissue between the thumb and the index finger, lifting it slightly away from the bone. Then they move slowly from one eyebrow toward the other, keeping the pinch steady rather than squeezing harder. This movement is done back and forth, left to right, then right to left, repeated 4 times in total, taking about 90 seconds.
That looks like a very direct way of working with tension people carry without realizing it. I imagine seniors immediately recognizing that familiar tight feeling there.
Exactly. I hear that often in seniors because this area works quietly all day whenever we focus, worry, or think deeply. When tension stays here too long, it can shape how the face looks and even how a senior feels emotionally. The important thing is that this should never feel painful, only firm and controlled, because release comes from consistency, not force.
So even here, it's more about steady attention than pushing through discomfort.
Yes, and when seniors take their time with these 4 passes, the tissue often softens and the expression begins to feel lighter. This prepares the forehead for the next step, where we work with broader movement to bring everything together.
I think we are almost finished by now. So after finishing those slow passes from eyebrow to eyebrow, what we do next?
Yes, and after all that work, we always finish gently because the nervous system needs a clear signal that the process is complete. Seniors place their fingertips softly across the forehead and begin slow, light brushing motions, moving smoothly across the skin without pressure. This touch is calming and reassuring, almost like smoothing the surface rather than working the muscle. It tells the forehead that it can rest now.
That ending feels very different from everything that came before. It sounds less like doing and more like settling.
Exactly. I hear that a lot in seniors who are surprised by how important this moment is. When they finish gently instead of abruptly, the muscles are more likely to hold the release they've created. This brushing helps the forehead return to a softer, resting state rather than snapping back into old tension patterns.
It feels like you're teaching the body how to remember calm.
Yes, and that memory is what carries forward into the rest of the day. And seniors take a moment to close this way. The forehead often stays lighter and more relaxed long after their hands are gone.
That's a powerful way to end the routine. But before we close, I have one important question. How often do seniors need to do this routine, and what can they expect when talking about results?
Of course, for most seniors, doing this routine once every 2 days is enough, especially because the work is deep and deliberate. In the first week or 2, many notice the forehead feels lighter and less tight, even before they see changes in the mirror. Over several weeks, the expression often softens and looks more at ease because the muscles and nervous system are learning a calmer resting pattern. The key is not frequency but consistency, allowing the tissue time to respond and settle between sessions.
That's a perfect note to end on. To everyone listening, please give this video a thumbs up, comment your age, where you are watching from, and let us know what you think about this episode. Oh, and watch this next video right now.
Yes, please.
We've picked this one especially for you.